My name's Julie Dingley, and 10 years ago I didn't have a lot going for me. I'm epileptic, I had no confidence and no sense of purpose, and my life was actually made up of daily visits from carers and weekly doctor's appointments and involvement with the community matron. And it was her who suggested that I might like to do some voluntary work once I was getting better, and that's where it all began. I had a bit of fear, I was a bit frightened at first, and then I started coming up here and finding people that I could communicate with, talk with, have a laugh with. We arranged transport for over 200 medical appointments each month so that they can get there safely and affordably with a driver who understands them.
My name's Chloe Myers, I'm the manager of Volunteering in Health. We're a health and wellbeing charity based at Teignmouth Hospital, supporting people to make positive and sustainable changes to their own health and wellbeing. So we've been based at Teignmouth Hospital for coming up to 3 years, and working alongside the rest of the team here has made such a difference to us, because now they really understand and value what we can bring to their patients and to help them as staff. We work really closely alongside the health and wellbeing team here, so that's nurses, social workers, physiotherapists, and whilst they're focused on someone's diagnosis, medication, equipment and care needs, we're really looking at the rest of somebody's life. So we don't really need to know what somebody's diagnosis is, we just need to know how it affects them and what they want to be able to do with their life and what's stopping them from achieving their goals. We've got a really thriving voluntary sector here with all sorts of fantastic groups and things that people can access. So we help people find out about the right thing for them and then get involved with it. So we'll take referrals from absolutely anybody. We don't have any eligibility criteria, and so as long as you live in the area, we will support people. People can come in and refer themselves, they can refer a friend or a neighbour or a relative, but equally we take a lot of our referrals from the health and wellbeing team here, from the GPs and from the social prescribing link worker who works with the GPs now. Loneliness is said to be as bad for your health as smoking 15 cigarettes a day. So we work really hard to try and combat that loneliness by getting people more involved in their community in the right way for them. And we also help with practical things like transport to medical appointments and cleaning and things like that. It's really hard to prove our worth because it's very hard to measure something like happiness or loneliness or confidence. Really hard to prove that we played a part in preventing someone having a fall or a hospital admission or getting diabetes. So it's been really good to work with two researchers to really try and gather some more evidence about those outcomes that we're achieving.
So some of the benefits from working alongside Volunteering in Health is that they can provide support with things like cleaning, shopping, transport needs, and they also help patients with isolation or anxiety issues that doesn't necessarily fall within the remit of intermediate care or social care. They are a great service at providing access for patients to find the relevant support for those things if they can't provide that support themselves, and they're overall just a wonderful service that can help patients remain as independent and happy as possible.
The opportunity of the Hope course arose, and it was something that I thought would really help because my confidence was still low, even things had got so much better. Hope taught me how to be resilient and how to feel empowered, and it showed me a different way of doing things, like writing a gratitude journal, look at what I have got rather than what I haven't got. It taught me how to set goals for myself. And I've achieved many goals since doing the Hope course. I found it very, very useful. I liked the Hope course and I believed in the Hope course, and I went to train to become a Hope course facilitator. And so now it's great because I can put some of what I've learned into practice and help other people who eventually also come along and volunteer. I did not know that the life that I have been given today would ever happen, and it is all as a result of volunteering. If anybody is out there and they think, what can I do? Is there going to be a part for me? Please get out there, volunteer, and it does turn your life around. It's turned my life around.